joining us for our Children's Health in Focus. Important conversations we are holding with experts on important and timely health-related topics. My name is Pernell Bryce, and I'm the Vice President for Policy and Advocacy here at the Children's Health Fund. Today's topic, Medicaid Unwinding Unwound, addressing the path to renewal. Before we get started, a little bit about Children's Health Fund. Children's Health Fund was founded more than 36 years ago around a core vision to ensure that all children of all backgrounds receive the healthcare that they need to thrive and succeed. From our central office here in New York City, we develop innovative solutions to meet the comprehensive healthcare needs of children from marginalized communities throughout the United States. We also translate lessons learned from on the ground, and we advocate for the health and well-being of all children. We lead a national network in 15 states, including Washington, D.C. and Puerto Rico, to bring quality care to children growing up in under-resourced communities from urban to rural. Our national partners deliver services to children where they live, where they learn, and where they play, through a fleet of more than 50 mobile medical clinics, including telehealth, and at more than 400 schools, homeless shelters, and other community sites. Now, before we get started, just a few housekeeping rules. If you would keep yourself muted throughout today's discussion, we would greatly appreciate that. Should you have any questions, feel free to leave them in the chat. Our colleagues will be monitoring the chat and we'll address them as soon as we can. And lastly, towards the end of today's Zoom briefing, you will see a link to a survey. We just ask that you complete that as soon as you can, as it will help us to continually improve our Children's Health in Focus Zoom briefings. Without further ado, I'd like to introduce today's esteemed panel. First, we have Dr. Lisa Barber. Dr. Barber is a pediatric pulmonologist and sleep specialist, and she's part of the University of Texas Dell Medical School Pediatric Advocacy Committee in Austin, Texas. Dr. Barber will share with us what's going on in Texas, and she'll also share how Texas is doing well in terms of the renewal process and some challenges as well. We also have Farah Erzouki. She's a senior policy analyst at the Center on Budget and Policy Priorities. She's on the health policy team that works directly on this important issue, the Medicaid unwinding. We'll hear from Farah what's going on from a federal level and what steps are being taken to sort of ensure things are being replicated throughout the country. And lastly, we have Ms. Jessica Rod. She's a manager at the Public Consulting Group. It's a national consulting firm, and she will share with us how the Medicaid unwinding is taking place from the education sector, as well as the renewal process from that area as well. Farah, let's start with you. As you and your colleagues know all too well, as of January of this year, roughly 2.8 million children have been disenrolled from Medicaid and CHIP. This is from a total of 7.5 million children who've been removed from those roles. I'm sure you would agree with me that these numbers are alarming, staggering, and quite frankly, unacceptable. Can you share with us and the group what steps are being taken to address this issue? And also, have there been any successes at the federal level?
Yeah, definitely. Thank you so much for having me. So, the Medicaid unwinding has really sort of lifted the curtain on barriers that people have been experiencing with the Medicaid enrollment and renewal process long before the unwinding even began. Administrative burdens are really leading people to lose coverage. As we've seen up until about this week, 17 million people have lost Medicaid since the unwinding began. And nationwide, about 70% of those who lost coverage lost it for procedural reasons. So that means that they didn't lose coverage because they weren't ineligible, and they weren't found ineligible by their state Medicaid agency. But it was because, they might have missed a paperwork deadline or, lost a notice in the mail. The inability to complete some step in the renewal process is what's causing most people to lose coverage. With all of this happening, states are dealing with large backlogs of cases, and all of this is really affecting their ability to approve new applications on time. And it's really having a domino effect that can have real consequences on people's ability to get connected to benefits. The unwinding process has really exposed many instances of where states fall short in longstanding federal requirements. So, for example, we've learned that some states don't let people, renew their coverage online or over the phone. Other states might not, screen enrollees for all categories of coverage that they might be eligible for before completing the renewal. And a lot of states, might not be, fully conducting what we call ex parte renewals for all their populations, which means that an ex parte renewal is an automated renewal where the state agency uses data sources to confirm eligibility for that person without requiring them to fill out any sort of form or take action. And ex parte renewals are a really critical way to keep people covered, especially after a pandemic where, state agencies haven't had contact with enrollees for years at this point. So many people have moved, lots of people's contact info has changed, and it's especially harder to reach folks now. But on the other hand, and sort of to your question, we've seen lots of innovation from states and really creative approaches to handling the unwinding. There isn't necessarily like one or two states that you would sort of lift up as a perfect example, but more so, there are lots of options that are available to states to make the unwinding process better. And we've seen lots of states take up those options to make it more likely for people to retain their coverage. So some of the things we've seen are, really good advances in communication with enrollees. So lots of state agencies are texting their clients about their renewals to be able to reach them more effectively. We're also seeing lots of states take advantage of flexibilities that have been offered by CMS to deal with the unwinding. So that can be, coordinating between Medicaid and other programs like SNAP to get more updated data on folks to be able to renew their coverage. We're also seeing states use, data sources like USPS records to update people's contact information because, like I said, a lot of people's information has changed and it's especially harder to reach people. And we're also seeing states make updates and improvements to their renewal systems. So, I mentioned the automated renewals, and lots of states are struggling with that. But on the other hand, a lot of states are also taking this opportunity to improve their rate of automated renewals. A lot of states we're seeing up to 50% of their cases are being renewed in an automated fashion. So this is really showing us that these changes are possible and that many of these changes can also serve as sort of these long-term fixes to ongoing problems that will positively impact Medicaid enrollees for years to come. So moving forward, it's going to be really important for states to build a system that better reflects the needs of enrollees and people who rely on, that coverage to have the health care that they need. So states should really leverage the lessons that they've learned during the unwinding to improve the renewal process and also make sure to keep people covered in an uninterrupted manner. So it'll be, really important moving forward to advocate for continued data transparency and for continued state accountability. I think those are the two main things that we're really looking to moving forward. On the data transparency front, we've had access to this data that states have had to report about their unwinding. This is the most data we've ever gotten from states on, their enrollment and renewal metrics. So really being able to have access to that and be able to use that to help states improve their processes in real time will be critical. And the accountability that CMS has implemented for states who do not comply, with renewal requirements. That accountability has allowed states to, reinstate coverage for eligible people and also has allowed states to work closely with CMS to improve their systems issues. And those things we hope will continue in the future.
No, thanks so much, Farah. That's great to hear that there are some successes from certain states throughout the country, and some of them are taking up CMS's flexibility around this issue. Um, that being said, Dr. Barber, I know Texas can be challenging for a number of reasons that we could probably talk about throughout this conversation, but specifically around the Medicaid unwinding. Um, can you share a little bit about how the state's leadership's willingness to be proactive is supporting the unwinding, or is really setting up roadblocks down there for you all?
Sure, and thank you so much for having me. So just a little bit of background that folks may not know regarding Texas is at the end of continuous coverage, about 6 million Texans were enrolled in Medicaid, and about 2 million Texans lost coverage between April and December of last year. Half, or about 1 million, were children, and the majority of those who lost coverage were related to those procedural denial reasons that Farah was referring to. And we found that Latino families in our state were disproportionately affected. Related to the underfunded, understaffed nature of our Health and Human Services Commission, as well as what could be considered a quite unrealistic timeline for the enrollment verification, the existing bulk of paperwork backlogs that were already there were amplified. Just to give a glimpse of where we're at now with that, as of earlier this year, approximately 120,000 Medicaid applications are currently in backlog, and about a third of those have been waiting for 9 months or more. Referencing Farah's comment on ex parte, or the data-driven renewals, in Texas, a little less than 3% of renewals have been data-driven, whereas the national average is over 30%, with some states, of course, performing much, much higher. The impacts of the loss of coverage have been felt far and wide in Texas. Personally, as a pulmonologist who cares for some of the most medically complex and vulnerable children, I've seen kids lose access to critical medications, lose equipment for the management of tracheostomies, lose ventilators, children who have experienced significant delays in care or postponement of procedures, or postponement of discharge home from the hospital. Additional effects of the unwinding beyond directly healthcare include the impact on school funding, which Jessica is going to expand on, as well as severe delays and backlogs in our SNAP, or Supplemental Nutrition Assistance Program, some referred to as food stamps, because the staff at HHSC, or Health and Human Services Commission, has had to shift so much to the unwinding. I can speak a bit to what have folks have been doing, and maybe what are some successes that have come from this, and maybe a little optimism towards the future here. Well, so many community organizations have been assisting with the re-enrollment. Internally, we've had a big communication campaign for our clinic patients starting well in advance of the unwinding. Our advocacy team has collected and is publishing a case series on vulnerable children who've been affected by disenrollment. We've also created an educational series and resources for stakeholders, including providers in the community, social work, financial counselors, and families. I do want to highlight some of the great work that HHSC, despite their underfunded, understaffed, overworked nature, has been doing in response to really this tragedy of the unwinding. They've been very transparent with their unwinding data, even more than what CMS requires of them for their monthly reporting. They've engaged a great deal in direct outreach to community liaisons and clients and stakeholders by creating an ambassador program with monthly calls. They've been really responsive when CMS has asked for any individual corrections or determination. They've loosened restrictions on what electronic data can be used to verify eligibility. For example, being able to use the food stamp data if you're qualified for that. Does that make you qualified for Medicaid? They've expanded data resources, including USPS, like Farah referenced, and some address databases from the MCOs. This was not done before unwinding. This is a new flexibility that has been introduced during unwinding. And then for the most vulnerable patients with the most medical complexity, they were given a 30-day longer grace period to submit their re-enrollment. The legislative and policy advocacy going on right now to hopefully improve and maintain any of these positive changes include advocating for HHSC to meet federal CMS standards, considering or recommending temporary waivers to extend coverage at the time of renewal, knowing that backlog, once an application is placed, can take months and months. Increasing ex parte, maintaining the process improvements and flexibilities that have been made during unwinding. You should become a rule and not an exception. And we feel that we're seeing some interest at the agency level with regards to enhancing that ex parte process. But stepping back, it does involve a state legislative level degree to enhance this commission that seems to be trying their best.
Yeah, I mean, it seems like although there are some staggering numbers regarding the backlogs, it seems like there are a number of organizations that are really stepping in and trying to make the best of a terrible situation. Jessica, as I said from the outset, the number of children who've been disenrolled is quite alarming. From your work as a national education consultant, have you seen any successes in select school systems that may be replicable in other states?
Absolutely, and I appreciate you highlighting schools as such an important and critical stakeholder within the Medicaid program. To set some context for folks, even though schools only represent less than 1% of the total Medicaid budget, Medicaid actually represents the fourth largest funding stream within education right now. Last published data, it was $6.5 billion that were going back to school districts to help support health services. I think when you think about the unwinding and the drop off in enrollment, clearly you'll see that there's a connection of, hey, if it drops by 20%, that means there's 20% fewer dollars going back to schools. I don't know if everybody's making that connection right now. Schools are also facing a funding cliff. They had tens of billions of dollars coming in during the public health emergency through ESSER, which was the Elementary and Secondary School Emergency Relief Fund. A lot of schools and departments of education were looking towards Medicaid in these upcoming years to be that stabilizing force in their funding. And again, with the unwinding, that's really put that at risk right now. So where we are seeing success is really when you're looking at agencies who are reaching across and having really deep partnerships on how they're working together to address re-enrollment. For example, in South Carolina, the Department of Education actually started sending out newsletters starting in March of 2023 to directly interact with their school districts to help them understand the potential impacts that were coming. The Department of Education in South Carolina has been working very closely with their Division of Health and Human Services, which is their Medicaid agency, to help share information and resources that are available at the Medicaid agency and making sure they're actually making it to the school districts where we know can be a community hub. It could be the only place where you're getting outreach to certain families. And I think South Carolina really highlighted that connection and making sure they were getting to everyone based upon everything you're hearing in terms of a lot of data, in terms of addresses, phone numbers, emails, and everything were out of date because there had been so much transiency during the public health emergency. One really creative thing that I found was actually the state of Missouri, whose Medicaid agency actually reached out to school districts to see if they could leverage their computer labs, keep them open after school hours, to allow families to come in and actually use the internet, use computers, and have Medicaid agency staff on site to help work through the application process. So what I'm hoping is that we continue to see this partnership. We're going to be advocating for it to help those agencies, because both education and Medicaid are severely understaffed right now, but how are they actually coming together to get to this population of children who really need these benefits?
Well, that's great, Jessica. That's great to hear what's going on in South Carolina and a few other states around coordination and communication. We know a lot of this sometimes is, unfortunately, people aren't communicating and connecting to ensure that, simple things are in place to get people re-enrolled. So that's really great to hear. We have a few minutes remaining. Farah, I just wanted to ask you one more question. Would you say, what have you seen in terms of on the federal level from a policy standpoint? Have legislators been talking about providing any funding? Has there been any legislative redress to around this issue?
That's an interesting question. I think on the federal level, it's less of a legislative issue as much as it is about an administrative issue. So you will see, legislators championing, and I think we, saw in Texas, Congressman Doggett has been leading a lot of the efforts in, just promoting better practices among, the state Medicaid agency, continuing like the drumbeat around data transparency and sort of even like advocating to pause procedural terminations when states are, have really high numbers of procedural terminations. So I think, the federal conversation has more so been about like identifying those legislative champions that advocates can really lean on to sort of help them further their goals in each of their respective states. And, like I said, we are seeing that happen in Texas and seeing the really positive impacts of that and, increasing transparency and sort of just shining a light on a lot of the things that are happening with the unwinding, because I think that in a lot of ways, the unwinding process has sort of like been swept under the rug and a lot of people don't even know that it's happening. So I think, using that federal landscape as an opportunity to bring greater awareness even to what's happening in each state, just like making it, using it as an opportunity to improve the process in those states, I think has been really promising.
Well, I appreciate that. And unfortunately, we are out of time. But I want to thank our panelists for joining us today, for providing timely information regarding the Medicaid unwinding and sharing some successes around the country from the federal and state level in our education systems and also through some of our health systems in Texas. This work is extremely important to us here at CHF. As I mentioned, we are focused on providing healthcare to marginalized communities and children who are growing in areas where resources are not rampant, are not where they need to be. We translate on-the-ground lessons to inform policy and to ensure that children can benefit. And we also work to ensure that children of all backgrounds can receive the necessary tools to succeed from a medical sense and also through a social and emotional sense as well. If anyone has any additional questions after this briefing, feel free to reach out to us and we can reach out to the panelists to answer those questions. As I mentioned, there is a link to our survey in the chat. We ask that you complete that as it will help us to continually improve. And we hope that you will join us for our next Children's Health in Focus and be on the lookout on the announcement of our next topic. Thanks and be well.